I'm Iris Perez. I'll be assessing the PRECEDE-PROCEED planning model. PRECEDE-PROCEED is a community-oriented participatory model for creating community health promotion intervention. PRECEDE stands for predisposing, reinforcing, and enabling constructs in educational or environmental diagnosis and evaluation. This is the portion that leads up to the intervention. PROCEED stands for policy, regulatory, and organizational constructs in educational and environmental development. This is the portion that describes the intervention. The PRECEDE portion of the model is divided into 4 phases. Phase 1 is the social assessment. This looks at what the community or planners want and need, and what outcome the community finds most important. Phase 2 is the epidemiological assessment. This deals with the issues and factors that might cause or influence the outcome we've identified in Phase 1. In Phase 3, the educational and ecological assessment identifies the factors that will create the behavior and environmental changes that we've determined from Phase 2. Phase 4, or the administrative and policy assessment, identifies best practices and any other forms of guidance for the intervention design. It also looks at organizational issues that might have an impact on the actual intervention. The PRECEDE portion of the model is also divided into 4 phases. Phase 5 is the implementation of the intervention. Phase 6, the process evaluation, looks at whether we're actually doing what we had planned to do. Phase 7, or impact evaluation, looks at the intervention and whether it's having the desired effect on the behavioral or environmental factors that we've identified in Phase 2. And in Phase 8, the outcome evaluation, we're looking to determine if the intervention really worked to bring about the outcome that we identified in Phase 1. So some strengths and weaknesses. Strengths of the model are that it provides foundation and structure for developing and evaluating an intervention. It also requires community involvement and therefore gets everyone in the community involved. It also allows you to evaluate in multiple steps with close monitoring, which allows you to adjust as needed. Because it's a multi-layer process, any intervention implementation can be really delayed, and the process can be very time-consuming. It can also require a great deal of resources because of its comprehensiveness and participatory process. So applying the model. Here I have applied the PRECEDE-PROCEED logic model for development of a program to increase the number of diabetes patients in Wilcox County, Alabama, who are completing daily foot and blood checks. This is utilizing a coordinated diabetes education, foot care kit, and healthcare provider initiative program. In Phase 1, I indicate the overall goal of increasing these checks. In Phase 2, I show the epidemiological and lifestyle factors of residents of Wilcox that may influence the intervention. In Phase 3, I show the predisposing, reinforcing, and enabling factors that influence Phase 2. Phase 4 indicates some guidance for the intervention and what administrative factors will be needed for a successful intervention. In Phase 5, I show the implementation of the education and foot care intervention in Wilcox. Phase 6, 7, and 8 show the evaluations of the intervention. Was the program carried out as expected? Did the intervention stay on budget, and did it have the desired effect that I had anticipated? Can this program be sustainable? Lessons learned. The model provided an easy and highly structured way to design and evaluate the diabetes program to be introduced in Wilcox. It also allowed multiple stakeholders to be involved in the process, which can increase success and sustainability. The challenges were that because of the limited information on residents of Wilcox and the previous interventions implemented in Wilcox or in rural Alabama, it became problematic since PRECEDE-PROCEED model requires extensive data. The model starts with the collection of data. If the data is limited, the planning and eventually the evaluations will be compromised. It will be only as effective as the data you're putting in. I can also see this as being a very time-consuming process. So my thoughts for improvement. It would be helpful to have more data on residents of Wilcox and prior interventions implemented in the county. It would also be nice to have more time to research the success of other foot care kit interventions and the sustainability of those programs. And to look for additional organizations outside of the Alabama Department of Public Health that could partner with the ADPH if funding were to be halted. Thank you.